Hello everyone. I am here to present the progress of my project. My name is Teodóra Filipov. I am a PhD student at the Department of Interventional Radiology, and my supervisor is Pál Ákos. My vision is to lower patient discomfort by offering minimally invasive treatment options and less invasive diagnostic tools. Yes, and my mission is to research novel techniques and stay up to date in this field. A quick overview of my project. The topic of the first one is kidney elastography, and the other two deal with cryoablation of benign and malignant tumors. Our first project that we started last year is a meta-analysis. You can see the title of our manuscript is ultrasound-based shear wave elastography of fibrosis correlates with biopsy findings in a kidney transplanted population. Okay, we know that all processes of allograft dysfunction ultimately lead to fibrosis. Therefore, interstitial fibrosis and tubular atrophy are the most common cause of allograft loss. And the gold standard method to reveal pathologic changes in the kidneys is biopsy right now, but although it is considered a safe procedure, it still holds its risks. Major complications of biopsies could be hemorrhage, AV fistula, and rarely even graft loss. A promising new modality to assess the kidney state is elastography, which is a ultrasound-based method that detects tissue stiffness. So we wanted to assess the correlation of shear wave elastography between elastography and clinical dysfunction parameters like fibrosis and laboratory results. After our systematic search in October, we identified out of almost 6,000 records, we were able to include 13 into our study. And regarding our outcomes, we asked for subgroup analysis according to the correlation calculation used, because these methods cannot be pulled together. We can see our main outcome was the correlation between elastography and biopsy, where we can see a moderate positive correlation by both methods. And additionally, we also assessed the correlation between elastography and RI, which is the resistive index, that is a calculated flow parameter of renal arteries, and also between elastography and the rise of creatinine levels. In both of them, we can see weak and moderate positive correlations, and also we have really high heterogeneity, because all of these studies are, the population of these studies are just very heterogeneous, and also the ultrasound method machines are different, so that could be a reason for that. We can say that this is the first meta-analysis dealing with this topic, and we provide a detailed renal function assessment, but there are several limitations, including the low number of studies and the very heterogeneous study population. And this problem of the correlation calculation is also a limitation. But in conclusion, we can say that the elastography is correlated with biopsies, but there is insufficient evidence to support elastography over biopsies right now. Right now, our manuscript is submitted to European Radiology, a 7 impact factor study. journal. Sorry. Okay, our next project, that is a new project, we started it this fall, is the cryoablation of low-risk breast cancer. A background is that according to the WHO, in 2021, 12% of all new cancer cases were cases of breast cancer worldwide. And with the help of screening and new technologies, the detection, the size of these lesions, tumors, at the time of detection are decreasing. And a lot of patients can benefit from a breast-conserving surgeries. And a new approach in this field is cryoablation, that uses liquid nitrogen to cool tissues to lethal temperatures. And it is fast, painless, and can be delivered under local anesthesia without the risks of open surgery. A trial published in 2021 has promising results. Almost, 1 out of almost 200 patients only developed a local recurrence at a 36-month time point. So, yeah, we want to, yes. For the intervention, we will use the ProSense device by IceCure Medical. It is a device that uses liquid nitrogen to cool a disposable cryoprobe, and this forms an ice ball around the lesion, and the ice formation alters tissue osmosis and damages cell membranes, and in the end it leads to lysis and cell death over time and instantly. We want to assess if cryoablation without lumpectomy is sufficient in treating low-risk early breast cancer for our patients to benefit from a non-operative treatment option. Inclusion criteria will be as follows. Women ages 50 and up will be included who have unifocal primary invasive breast cancer. Also, these lesions cannot exceed 15 millimeters on their longest axis. And yes, the breast has to be of adequate size for cryoablation. And important is that these patients should be lymph node negative, hormone receptor positive, and HER2 negative, yes. And patients with multifocal or multicentric disease or calcifications will be excluded, and also the presence of lobar carcinoma or luminal B pathology will not be allowed. We will assess a few outcomes. Our main outcome will be the local tumor recurrence in the breast up to we plan this into a 5-year period, and also the success of the tumor ablation will be assessed. As secondary outcomes, we will assess the patient's quality of life, overall survival, and the disease-free survival. Right now, this trial is in the phase. We have to hold an interdisciplinary discussion to finalize our protocol draft, and then calculate sample size. And our third project, that is the cryoablation of fibroadenomas, is under ethical approval right now. So yeah, a quick summary. Our meta-analysis is waiting to be published at a journal right now at European Radiology, and the other two projects I want to submit as soon as possible. And let me end my presentation with a quote from one of my favorite TV shows, which is, "Don't wonder why people go crazy, wonder why they don't." Thank you.
Congratulations, Dorka. I just want to ask that in your protocol, if you exclude multifocal tumors, and why do you include contralateral
that is just a
breast cancer?
It is not finalized yet, so we still have to talk to oncologists and specialists to decide that is only a plan, because in some studies that are present in the internet and in the literature, one of the studies, they included contralateral disease. So we have to decide on that. And nothing is finalized yet. It's just a draft and a plan.
Probably worth a try with the oncologist. Congratulations again.
Thank you.
Congratulations. And first of all, again, because we have the time to have also methodological suggestions. All the time, the most important is to have the papers submitted to journals. Never keep it on your laptop without being submitted. So because last group meeting, you were saying something about your project that you wanted to change major stuff. That's why I'm saying that never keep it. Keep resubmitting it, and don't be disappointed because of this. However, congratulations on the phase of that study. I was just wondering what kind of research questions did you have after the study, because I was just wondering if there would be a good quality register. Then maybe I would also check that besides shear wave elastography, what other parameters can actually increase the correlation of the shear wave results with actually the biopsy. So do you have anything on this, whether what kind of combination can help in the prediction of transplant failure or something?
Well, not really. Like elastography, it assesses the stiffness of tissues, and which can be correlated with fibrosis on biopsies. But of course, biopsies also look at other signs of pathologies that maybe cannot be detected non-invasively. But yeah, we were just concentrating on fibrosis, really.
Thank you, Dorkan. Also, according to your quote, so if you go crazy and use it for breast tumors, we were just wondering if you have got any info on, for example, benign prostate tumors, the use of cryoablation, or uterine fibroids, because these tumors are very, very common, cause a lot of clinical problems, and this method could be. So why we don't go crazy in urology and gynecology and try this method?
Well, I haven't really looked into but I think that there is, that someone is doing cryoablation of prostate, but I'm not really up to date in that in other fields. We concentrated on the breast, actually. So, but I'm sure it's doable. But uterine fibroids, well, yeah, well.
Okay, we will take a look after that. Okay.
I will look into it, and we can maybe collaborate on something.
Very good idea. Thank you very much.